The South African Health Products Regulatory Authority is concerned about the proliferation of falsified, compounded and substandard glucagon-like peptide-containing products being made available to the public via websites, social media platforms and other informal channels. Now, these pose a health risk to the public. SAHPRA cautions the public to not purchase or consume such products as they say, as their safety, efficacy and quality have not been assessed. Let's bring in SAHPRA Senior Manager for the Inspectorate and Regulatory Compliance, Deon Poovan, who joins us to expand on this. Deon, a very good evening to you. Thank you so much for your time. As you make this warning against the proliferation of falsified, compounded and substandard glucagon-like peptide-containing products, what exactly are you referring to?
So what we are, as the South African Health Products Regulatory Authority, we're concerned about three things. Number one, substandard glucagon-like peptide medicines, which we've seen or haven't been proven to be the same as registered medicines. We're seeing that in compounded medicines, where the compounded medicines, we can't confirm whether they contain the same active ingredient as the ones that are registered. The second one that we're concerned about is unauthorized medicines. So these are medicines that may contain the GLP-1 agonists, but we've never reviewed them as SAHPRA for their safety, quality and efficacy. So it's a concern for us that people may be taking them and that they are being made available through illicit means for consumption by the public. And the third concern we have is falsified medicines. Now, these are medicines where criminal elements are actually portraying drugs that are not the original as the original and then convincing the public to actually consume them.
When you talk about consumption by the public, I would take it you're also referring to the public, which may not necessarily be somebody who has diabetes. We're seeing a massive trend when it comes to products like Ozempic, where people are looking at it as an option for weight loss. What are the dangers around there?
Okay, so the danger around taking a medication that hasn't been prescribed for you, in itself, that is already a danger, because you're taking something where a doctor hasn't evaluated you, the doctor hasn't seen whether or not you can take this medication. So you're taking it without the supervision of a medical practitioner. The second part that I want to mention is about off-label use. So when a doctor looks at your condition and says, okay, I'm going to use a product like Ozempic or Mounjaro, which is indicated for type 2 diabetes, and I'm going to prescribe this for you for weight loss, it's allowed because a doctor is going to make sure that they take the risk of you using that. And the third thing is that because people know that these GLP-1 agonists can cause weight loss, they tend to find other ways and means of finding these without going through the proper channels. And it's this demand which is being caused by global knowledge. I mean, our public, they are aware of what's happening out there in the world. They are aware that these semaglutides and tirzepatides are being used for weight loss. And then they start using it without the supervision of a doctor, and that in itself can cause harm.
The supervision of a doctor, I mean, you've just said that the doctor will take the risk if they have prescribed this kind of medication to a patient for weight loss. What would some of the requisites be? Why are we not seeing more and more people who would like to lose weight because they feel unhealthy, or they would like to be whatever the reasons are? Why are we not seeing more doctors prescribing it to patients? I mean, surely if there is authority to prescribe it, then it should be available to those who need it.
Yeah, I mean, that's up to the doctor, right?
Yeah.
I mean, the doctor is going to follow what the indication of the medication is. So a doctor is going to try and stay within what the regulator has approved the weight loss for. And I'm saying this in the context of the fact that there are GLP-1 agonists in South Africa that have been registered for weight loss. It's because of this popularity of using a type 2 diabetes drug for weight loss that has increased its demand. And because when there's a demand and there's no supply, people turn to other illicit ways of getting the drug. So the doctors do tend to stay within the registered indications. They'll turn to a drug that has been registered for weight loss. And as I said, there are GLP-1 agonists registered for weight loss. And only in specific cases, maybe there would be a specialist or something that sees, okay, I need to, or this person is not being controlled on normal diabetic medication, or they need to find another way to manage their weight. It's up to them as the doctor to decide, okay, let's try the semaglutide for weight management and prescribe it off-label.
What are the health risks if one is self-medicating on such a drug?
Okay, so the one action that GLP agonists do is that they reduce your blood sugar levels. I mean, that is why Ozempic and Mounjaro have been registered for diabetes treatment. So when you're having these blood sugar levels going down, imagine you having already a low blood sugar level, right? And you're taking this for weight loss. Can you imagine the side effects that you would have from being hypoglycemic or having too little blood sugar? So you need to take this under and that's just one example, right? I mean, there are other examples of adverse effects, particularly affecting one's pancreas, that one can get when using a substance like semaglutide. So it's very important that these substances are prescribed by a doctor. There's a reason that SAHPRA has put these substances under Schedule 4, requiring a prescription, because you need to have the medical supervision of a doctor. Otherwise, you could cause more harm than good to yourself.
Yeah. Talking about causing harm, we've seen that with the massive demand for Ozempic, that the actual patients are bearing the brunt of it, where there's shortages in some instances.
Yes, so I mean, the company has mentioned, and they put it in the media, they're going to be having shortages up until the end of 2024. And this is a concern for those patients who have been prescribed Ozempic for diabetes management. But on the bright side, there's a little bit of silver linings that there are other diabetes medications. So if you are prescribed Ozempic for use for diabetes and you aren't able to find it, you should ask your doctor to prescribe for you an alternative treatment.
As we observe World Diabetes Day today, how far has the medical fraternity come in terms of managing and identifying diabetic patients?
Well, I suppose it's twofold, right? I mean, we've just seen now how the Gauteng Health Department has reached out to the community, right? So it's also up to the community. I mean, as I said, as you get to a certain age, you need to go for regular checkups. But if you aren't doing that, there are signs that you may be experiencing the symptoms of diabetes. For example, excessive urination or excessive weight loss. So when you're seeing such signs, you should seek the help of a medical practitioner. But other than that, every year you should go for your checkups, check your blood sugar levels to see, are you perhaps becoming pre-diabetic, especially if you are prone to diabetes.
Very well. Thank you so much for speaking to us this evening. There, of course, leaving that conversation, SAHPRA Senior Manager for Inspectorate and Regulatory Compliance, Deon Poovan, there, speaking about the dangers of using certain drugs like Ozempic, advising that you consult a doctor should you need it. Now,